The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of breast surgery. With us, we have an expert on the topic, board-certified plastic surgeon, Dr. Corbin. Dr. Corbin, welcome to the program.
Thank you.
All right, now you have a big practice, I guess, in LA.
Yes.
And thanks, and we've been trying to get you on the show for a couple of months, so thanks for coming down. Now, before we get into today's topic, and we're talking about breast today, but you do just about everything in your practice?
Yes.
Is that correct? I mean, who's the typical patient you see?
My typical patient can be a man, can be a woman, can be a child, or it can be a transgender individual who is unhappy with one or more aspects of their appearance.
So you do facelifts?
Yes.
Nasal surgery?
Yes.
You do fillers and Botox and all of those things?
All of those. And we have, you know, a website, Nose Expert, and for men, gynecomastia expert.
You have several websites?
Yes.
And thebreastexpert.com. And by the way, people just tuning in, we're talking about breast today, what you need to know. Very unusual site. And I say unusual because I look at websites, I interview doctors all over the country, and yours is it's about beauty and it's about self-esteem, and it's like makeover after makeover after makeover. I mean, you feature these patients.
Well, what we do is take your average patient and essentially convert them into Playboy models.
Because they all look like models, by the way, on the site.
Yes, so and they're all ages, too. I mean, if you look at the website, you'll see there are young girls there that people would associate with Playboy, some of whom actually are playmates. And there are housewives and mothers.
And you have a celebrity clientele as well.
Of course.
A following.
Yes.
Now, how long have you been in LA, by the way?
Oh, God. I completed training in 1979 and came out to LA in 1980.
Okay, good. Now, your background in training, tell me a little bit about your training.
I'd love to. Basically, what a lot of people don't understand is it's a long road to become a plastic surgeon. So basically, I have 10 years of training, 2 of which was in the military as a major during the Vietnam conflict. But I initially started out as an intern at UCSD, completed my general surgery training at Tufts University, my plastic surgery training, as well as a fellowship in hand surgery at Columbia University, right. And then also have 2 years in the military in between there.
Okay. Now, you do a lot of volunteer work.
Yes, I do, and I get a lot of pleasure. Yes. Matter of fact, that's, I think, what I'm most proud of.
You told me on the phone, you said, Randy, if I could do that full time, I would do that. I mean,
I absolutely would.
Because of the changes in their lives?
Yes, and because it makes you feel even better about yourself because you're going somewhere where they do not have, you know, the teams of people to correct these problems, and you just feel good. I mean,
do you do it once a year? You do it at least?
Yeah, I try to do it at least once a year.
Is there a connection? That means the results you get in another country fixing somebody's face or problem with what you're doing today in your practice?
Oh, absolutely.
And what is it? What is it?
Basically, it's we're improving the self-esteem of those individuals in the third world countries, as well as the self-esteem of people in the United States.
Okay, now moving on to breast surgery, and what people need to know. What who's the typical patient, and what are the age ranges now that you see? And is it the number one procedure? I mean,
well, actually, I think it is the number one procedure in plastic surgery. In my practice, though, your average patient is any age.
Okay.
Who are concerned about their breast.
I mean, are the patients getting older and older for breast surgery now as compared to 20 years ago?
Yeah, well, you could say yes. I mean, we still see the patients, you see the patients in their early 20s and 30s who want to enhance their breasts. Similarly, you have patients in their 20s and 30s who are horrified because their breasts are too large, which prevent them from doing some of the, activities they like to do. Or, even worse, their breasts developed asymmetrically. And so now they have one huge breast on one side and very small breast on the other, and they literally can't wear a bathing suit in Southern California because they look funny. And then you see patients after pregnancy where their breasts have tremendously changed, or after, weight gain and weight loss. And then unfortunately, you do see some patients who have developed breast cancer, and their breast has been ablated in one form or another, and they're coming to me for reconstruction.
Okay. Now, what about silicone or gel-filled versus saline implants? I mean, do you have a preference over one?
Not that I do, but I present to the patient what the options are relative to silicone and saline, and there are a lot of misconceptions, I think.
Like what?
Regarding, well, there was a moratorium placed on the use of silicone gel implants in 1992, and that has scared a lot of patients. Now, the implants were placed back on the market in around 2006 for everybody.
So they're safe now today. I mean, that's not an issue.
They are considered, but many patients don't believe that.
Is that right? Really?
And so they're afraid.
Now, the gel-filled have a natural flesh feel.
They do.
Is that correct?
Yeah. If you place a saline implant and a silicone gel implant underneath a towel and have 100 people feel them and say, which one do you think feels more like a normal breast? 99.9% of the people are going to say the silicone gel feels more natural.
Okay.
But in many patients, you can't tell the difference because it's a function of how much tissue overlies the implant. And the more tissue the patient has in front of the implant, the less you're able to tell the difference. Okay. So in a very thin individual, in my judgment, they're not a good candidate for a saline implant. But someone that's slightly heavier, it might not make a difference.
Okay, now what about incisions? Do you have a, through the belly button?
The choice of incision, again, is part of the planning. Not every patient, in my judgment, is a candidate for every approach. And so consequently, there are some patients who I try to steer away from an approach because I feel it will compromise their final result. And that's been, in some respects, proven to me where I've had patients come in and want me to do a procedure through an axillary approach, which I happen to do a lot.
What's that, the armpit area?
Through the armpit. And I'll tell them I don't think they're a candidate for that approach. They will interpret that many times as meaning, well, he just can't do it that way.
Doesn't do that way.
And go to someone else. And then that same patient...
Well, then set the record straight here.
Well, they'll come back to me after they've been done by someone else, and they're unhappy with their result. And they think the doctor did something wrong. And I said to them, the mistake was doing you through the axillary approach. And that's why I didn't want to do you that way.
Interesting.
And the same thing applies with the tuba approach, the belly button approach. Not everybody
You think
is
that's
a candidate.
gimmicky, by the way?
In some respects, yes. But for saline implants, it is an option.
So where you place the incision, whether it's in the fold, through the nipple area, through the armpit area, you're going to pick the one that's going to give them what? The most natural result? Is that what you're saying?
Correct.
Is that
I try to lead. I view myself as a patient advocate. I try to take my knowledge, my experience, and apply it to their individual problem and do for them what I would do for my daughter or for my wife or for my mother. Part of the problem is getting patients to believe you.
Okay.
Because they hear so much, they go on the internet.
Well, they come in now today, they already know, right?
Right. They
know
think
the size,
they know.
They know everything.
Right, but they don't have any experience. They have a lot of knowledge and no experience. And it's
so you're stubborn that way? That means you don't want to let them make a mistake?
Correct. And many times I have patients come in who are seeking liposuction in place of good diet and exercise habits. And I'll tell them to go out and diet and exercise. Similarly, patients coming in for breast reductions when they're overweight. And I'll tell them, lose the weight first. You might not even need the breast reduction, or you'll just be coming in for a simple breast lift. So I am a physician. I care about the patient. I'm trying to do what's in their best interest. And sometimes part of the problem is getting them to listen to me.